Stop. Good afternoon, everyone, and welcome to today's SADC Ask the Expert session. Our topic, the mental health of healthcare workers matters.
We
So
haven't
healthcare
started,
workers,
Daryl.
oh, too soon. Good af, am I starting? Good afternoon, everyone, and welcome to today's SADC Ask the Expert session. The mental health of healthcare workers matters. Healthcare workers dedicate their lives to caring for others, often under immense pressure and in emotionally demanding environments. Yet many find it difficult to prioritize their own well-being, seek support when they need it, or acknowledge the toll that caring for others can have on their own mental health. Today, we'll be exploring some of the unique challenges that healthcare workers face, the impact this can have on well-being over time, and most importantly, how support, connection, and recovery are possible. Thank you to everyone joining us live today. If you're in Joburg, I'm sure you're feeling the first cold bite, and wherever you are, feel free to drop a comment and just say hi and how you're feeling today. I'm delighted to welcome our two guests this afternoon. Our first is Heidi Nessler. Heidi is an independent social worker with over 3 decades of professional experience. Currently based between Johannesburg and Sedgefield on the Garden Route, she is an accredited group analyst through the Institute for Group Analysis in the United Kingdom and trained through the Ububele Psychoeducational Trust's Working with Groups program. Heidi is deeply passionate about relational life and works with individuals, couples, and groups to support emotional well-being, growth, and connection. Her journey into social work began in the 1980s as a volunteer lay counselor for Power, which inspired her to formally qualify as a social worker in 1990. Over the years, she has worked extensively as a counselor, mediator, trainer, and facilitator with a particular focus on trauma recovery, relational dynamics, and reflective group spaces. She currently facilitates the Healthcare Workers Care Network support group and provides support through individual, couples, and group therapy. Welcome, Heidi.
Thank you, Daryl. Gosh, yeah, it makes me sound very old.
Makes you sound remarkable. And then I also want to welcome Dr. Kanyile. Is someone who has dedicated her life to healing, not just bodies, but minds, communities, and spirits. Dr. Nogokanya Kanyile Lenaka is a South African medical doctor, specialist, pediatrician, author, changemaker, and keynote speaker. She studied medicine at the University of the Witwatersrand, where she earned her Bachelor of Medicine and Bachelor of Surgery before going on to serve at some of Johannesburg's most prominent hospitals, including Chris Hani Baragwanath and Rahima Musa Mother and Child Hospital. But her impact reaches far beyond the clinic. Dr. Kanyile is a passionate mental health advocate and vice president of Mental Matters, a mental health care platform dedicated to destigmatizing mental illness, educating communities, and empowering people through medicine. With a following of hundreds of thousands across social media, she uses her platforms to engage, educate, and inspire, championing the belief that true well-being is holistic, physical, emotional, and spiritual. Welcome, Doctor.
Thank you so much, Daryl, and hi to everybody. Hi, Heidi.
Hi, Nokukanya.
So good to have you both. And with a packed half hour, let's dive right in. So let's begin with why healthcare workers tend to struggle. So, Dr. Kanyile, I'm going to come to you first. Healthcare workers spend their lives caring for others. Why is it often so difficult for them to prioritize their own mental health and well-being?
Thank you so much, Daryl. So, if you look at the journey of a medical student or a nursing student, someone who's in the allied health profession, we understand it's very competitive. So, we spend a lot of our lives competing with other people to get into this place. We're very high performers. We want to do things a particular way. And we understand that the standards that are placed on us are a little bit higher than the standards that other professions or other people in our families might have for them. So what you find is you get a very high strung person, very high achieving, and high with a lot of demand placed on them, who's then put into an environment that is incredibly stressful. The public health society system in South Africa, even before moving into private, has a lot of resource shortages, staff shortages, and you get a very high patient load and volume. And even if you look at the pathologies that we see in South African healthcare, people come from other places in the world to come and train because of the seriousness and the volume of patients that we see. So there's a lot of factors that puts a physical burden of long hours, very difficult working conditions. And then on top of that, you have people who are used to performing and shining their whole lives, being felt or being made to feel that they're not doing enough. They're not doing enough for their patients. I mean, they might not even be getting the accolades or the recognition from their colleagues. And that makes a very high stress situation that chronically happens over time. And because of our hours and because of the under resource, we're not given the space to and the time to work that out. And that leads to burnout. And as we know, over time, burnout can lead to significant mental health challenges, even leading to physical illness in some.
Mm. That's one of those sort of aha answers. Like as you said it, I was just like, of course. I mean, if you take the competition to get in, totally get you. And
Mm.
Heidi, in your support groups, what are some of the most common concerns or experiences that healthcare workers tend to share in the groups?
Such a wide question that's really kind of we need more than the half hour to
I
answer
can
that one. But
imagine.
the usually it's exactly what Nokukanya has mentioned. The sense of being under enormous pressure. Um, I'm tempted to say that often it doesn't even occur to healthcare workers to take care of themselves. They're so busy focusing on trying to get through the day or trying to meet the enormous demands of the world that they're working in. And yeah, so the most common issues that keep coming up are shortage of time. And often people will say there just aren't enough resources and there's so many patients and there are only so many hours in the day. So the emphasis is often on shortage of time, shortage of energy, shortage of physical resources, an overabundance in a way. There's never a shortage of patients or there's never a shortage of problems that come up. And I think it becomes a way of thinking that in a way you're living in a world of shortages all the time. And one of the beautiful things about a support group is that when you start tuning into people's own expertise, that's the other thing, is that people always think someone else is the expert. So if I can gently push away the label of expert and just sort of really, focus on the expertise that we all have of our own lives, of what works for us and what doesn't. And also, you know, to notice our own signals of when we're pushing the limits. So for instance, when you talk about a support group, the fact that someone phones in, and maybe the fact that someone is tuning in today to this particular meeting, is already a great first step because it means somebody's interested, is curious, somebody's saying, "Hang on, maybe I can benefit from someone else, or maybe I could use some help." Sorry, I could go on and on for ages. It's a short question with a very long answer. Can I challenge one word though? I
Yeah.
wonder if many of us struggle with the idea, the word help. And it's funny, you would think that help is such a natural human kind of need, that we all are social creatures, we all need each other, all that stuff. And yet, the idea of needing help becomes something negative somehow. I'm not quite sure how that happens. Maybe the competition that Nokukanya mentions,
Yes.
maybe the sense of just being so exhausted that you just can't think of anything else. But I like to try and reframe the idea of help. being like to bring in another mind or have someone to talk to or uh, have someone to share some ideas with or to, yeah. So I'm not saying we shouldn't have the word help, but somehow we associate help with neediness. And I don't know. I hope you know what I'm saying. I'm a bit long-winded.
No, I totally get it and I love it. So for this Friday, I think we instead of calling it Ask the Expert, let's call this session Share the Expertise. And instead of
Absolutely. Yay.
help, let's
Yes.
bring in two other minds. So
Great.
I'm with you, Heidi. And Dr. Kanyile, we've sort of touched on this the shortage of resources and then this almost abundance of patients, clients in need. And I think you even already touched on it, but there's often this expectation that healthcare workers should be resilient and simply push through. How
Mm.
does this culture start to affect the well-being over time?
Yeah, so I'm really glad Heidi was talking about how the concept of help can seem like a weakness because I hear this all of the time when we have new interns and new doctors coming through, and we're like, we used to do 32-hour calls like nothing. And we used to not eat for 16 hours and we were fine. And yes, that used to happen, but that doesn't mean that it's okay. And yes, you had to be strong at that point in your life because that was what the system demanded. That's what the information that we had as healthcare professionals about working in the healthcare system was at the time, but we
Mm,
have new information. And I think there's a disconnect between what we would call the old guard and kind of the new guard coming in because mental health in patients was acknowledged, but it was seen more as a diagnosis. Whereas with us, mental health is an everyday lived experience, whether
And
we're
a
dealing with
positive thing.
Alzheimer's.
Sorry to interrupt. And a
Yes,
positive thing. It's a good thing to have
absolutely.
mental health.
Yes, and not just mental health within yourself, but also mental health within the team. Because I see it
Mm.
all the time, and this is what I love about pediatrics. When we work in pediatrics, an understanding that we can't all do everything at the same time. So if an intern is seeing a patient and they're not sure, the first thing they do is they call their senior. If I, as a registrar, am on call and I need help from a consultant, that's what I do. I pick up the phone and call. And for us, help is I don't have enough information to manage this properly. I need assistance. And that assistance is not
Mm.
saying I'm weak. It says
Mm.
I'm limited
Mm.
in what I have. So I need help from someone who's got more experience. And for us, that's a positive because it's very important, I think, in mental health to understand where your limits are, where your information ends, and to get that, Even when I think about it's something as simple as eating on a call. Whenever I walk into a call, a lot of people don't walk around with food or little snacks on their person because they're like, I've got a big meal. I'm gonna wait till I get to the eating room or the dining room and then I'll eat there. And I know as a registrar, I need to have a snack bar when I was working on call or even as a consultant. I have to have a snack bar with me because the patients will not finish. My work will not finish, but my energy levels will finish. So I need something to eat on the go. And it was like my interns' minds were like open because they're like, what? We can do that? And I'm like, yes. You're not sitting talking to a patient and eating, but while you're away from the patient, writing a note, or while you're walking on the way to drop off a sample, you can eat that quick bar and it will help. Take that 2 minutes to go to the bathroom and come back. And when you understand that pushing through and being resilient can mean that you have different strategies that you can apply to that using the collective intelligence of people who've done this before, who've learned and made the mistakes and have learned from them. We can actually ensure that as a staff, we are better taken care of, and therefore we can take care of our patients better.
I love that idea. I mean, what it brings to my mind is for those of us who drive a car, and I know not everybody does, so find your own example if whatever applies for you. But we usually treat our cars better than we treat ourselves. We don't expect our
Yeah.
car to go up that hill if we haven't filled it up with petrol, or if we wait until it's making that terrible noise before we go for service. We
Mm.
know we don't let that happen because we value our car and we regard it as something we invested a lot in. I like to think of mental health as a worthwhile investment without
Mm.
which it's like the car, without which you couldn't go to work, without which you couldn't get up that mountain, without which I don't know, let me not get all metaphorical, but mental health really is, we live in an exciting time, I think. We always emphasize the negative, but mental health has become a talking point, which I think is fantastic. It didn't used to be. It used to just be so stigmatized, still a little stigmatized, we know that. But at least it's out there in the open. People are talking, people are arguing, people are debating. And I think that's a great thing. And I'm making a call for investment in mental health. Same as you invest in your pension fund or you invest in your garden or I don't know what, you invest in your children. Oh, and I was so glad to hear there's a pediatrician on board because it gives us perhaps a reminder of the importance of children and that we're not just looking after patients, we're also raising the next generation of young people and children. So I don't know, I find it an exciting world, but yeah, there are some challenges that need to be confronted.
I love how when you're each speaking, I'm seeing the other smile and nod, like it's really resonating. And I totally agree with you, Heidi. The fact that we are having these conversations, sometimes from SADC, we're invited into these rooms and we address people on sometimes what we call mental health 101. And it elicits quite strong responses from the audience. And sometimes you stand there and you're almost overwhelmed because like you feel this need to have solutions. But if we just take a moment to acknowledge the fact that we're having these conversations and asking quite complicated questions is the progress, because all of this is a process and it's about understanding and listening to one another. And I've got a question popping up from an audience member, and she's saying, I love my job, but lately I feel emotionally numb and disconnected from my patients. Is this a sign of burnout, and what can I do about it? And I open that up to both of you.
Yeah, absolutely. So it's interesting because the World Health Organization defined burnout and mental health in 2019, which I don't understand because everybody on the planet has a brain and that brain has mental health or illness. But anyway, thank you so much for that question because we don't really know what burnout is until you have it. And so I want to just look at the ICD-11 classification of burnout. And that is, it's a syndrome, which is a constellation of signs, conceptualized as resulting from chronic workplace stress, which I think everybody on this platform would have. Chronic workplace stress that has not been successfully managed, and it is characterized by three dimensions. Don't put up your hand, just look straight ahead if this is you. The first one is feelings of energy depletion or exhaustion. The second is increased mental distance from one's job or feelings of negativism or cynicism related to one's job. And the last is reduced professional efficacy. And so when you think about that, sometimes you have a bad day at work, you don't feel like going into work because maybe there's a tricky presentation, or maybe you had a fight with a colleague and there can be some negative feelings. But that's not what burnout is. Burnout is when you've had this fight. It's creating a toxic environment. You're now not talking to this person. Every time you work together, it's difficult. You're unable to focus. It's now extending to gossip or it's extending to bad behaviors. You have to interact with this person all the time. You don't want to go. You're feeling very stressed. You're not able to concentrate at work now because you're worried about this. You're struggling to match targets. You're feeling criticized. And over time, because that initial situation wasn't managed, it becomes chronic workplace stress. And when you don't deal with that in a healthy way, that's when it becomes burnout. And burnout can, vary. There's mild, moderate, and severe burnout. Severe burnout can even last up to 3 or 5 years. So you find that in a situation like that, I would definitely say, yes, you have symptoms of burnout. But what is important about burnout is that it's not just up to the individual to recognize that they have burnout. It's up to institutions and organizations to say, what are the things in our organization that are creating burnout? And how do we manage it so that we don't precipitate it? So if there is conflict resolution strategies that need to be implemented between managers or between workplace colleagues, if there are people coming back from mental health or sick day leaves, they need to be assisted. How do we communicate with the team without necessarily promoting stigma and causing people to feel shame about having to maybe take a step back for a month or two while they reacclimatize. All of those things are important for the workplace and the system in the workplace to help the individual prevent burnout and also ultimately prevent burnout in the long term for the organization itself.
Can I come in there? Sorry, Daryl,
Yes.
I don't know if that's okay with you.
Of course, please do.
What I hear you saying really is that burnout is a late stage of something. And I like to think of it as the brain screaming. It's actually it's gone beyond screaming. It's actually said, well, she's not going to listen to me. She's not noticing that I'm empty tank. I'm just going to cut out. In the old days, I've got white hair, so I'm old enough to remember, you won't. Used to be a thing on computers that if your computer was overloaded, it would sort of cut down to its most basic. I forget what it was
Mm.
called. It doesn't matter. It would give you some kind of warning that's saying, I can't go any further. I'll just give you black and white, or I'll only give you A or B. And I
Mm.
think burnout is when we have not noticed, and it's easy to miss it. It's like the crocodile in the river. It's sneaks up on you. You don't notice, which is why your idea that it would help if other people would notice common signs of burnout, like all the, stress is normal. Hey, in fact, stress can be great. We
Yeah.
all, I'm sure, remember the good stress days of when we started this work, where it was exciting, it was stimulating. Bring them on. This is what I've wanted to do all my life. This is what I've trained for. So stress itself is not a bad thing. It's when stress becomes overbearing and becomes
Mm.
overwhelming and floods and just sort of causes that computer to start crashing. That's when it really is not a good thing. And great if you notice it, but wouldn't it be better, as you're suggesting, if we noticed it a heck of a lot earlier? So that's where investing in healthcare and understanding what is needed. And I always think of a table. I think of a four-legged table for stress management. It's just, you can hear, I think, in images. I like the idea of we need at least four legs. And if this was a workshop, I would ask everyone to give an idea of what the legs are that they need in their table. But to my mind, if your relationship, you've got to be able to have good relationships, whether that's at work, whether it's with your family, your spouse, your partner, your best friend, your supervisor, whoever it is, you need social contacts, not just physical contact, but you actually need relation. We are social creatures.
Mm.
And you need to be able to count on that as one of your stabling legs. The
Yeah.
other one, of course, probably the first one that you would maybe think of, is the physical leg. If you're not looking after the body, so what does that mean? Sleep, food, what you put into your body and what you don't. I mean, the bad things we put into our body don't help. The things we often grab for, reach for to make us feel better in the short term, with apologies to Grandpa Headache Powders, we often reach for the headache powder, and yes, it helps in the short term, but it doesn't tell us why we're getting the headache. So sometimes that can be its own worst enemy. So the body, what else have I said? You mentioned skills, different life skills, conflicts, what we call the soft skills to invest in or develop as you grow. Sometimes they happen naturally, but sometimes you go out and chase them. Go and develop your negotiating skills so that you can negotiate in the workplace what is reasonable and what is not, what is legitimate and what is not. What else have they? One of you might come up with a fourth leg. I don't want to take up all the space here. I'm sure there is one. And of course, a lot of this stuff is unconscious. So it's all very well talking about all the things we can and should do, but often we're on such autopilot. So can I add awareness as a fourth leg? There are many different kinds of tables, so you can all design your own. But for me, awareness, self-awareness, and I love the fact that you've mentioned the institution. So I could add colleagues or friends or people who notice, hey, a supervisor who says, I've noticed that you seem very irritable with this particular client. I'm wondering what that's about, or you don't see, when you start noticing what did that person ask, numbness and not feeling anything but for the patient.
Yes.
It's got a name. We call that compassion fatigue, where you used to really care. So you're now experiencing loss. You're now experiencing that you just feel flat. I mean, those are things to be aware of and to take seriously, because then we listen to our own. We've got an amazing brain, which
We do.
looks after us, and an immune system that just kind of is. I've just come through flu, so I'm hugely respectful of the immune system. I can't believe what it managed for me, but not if we don't also respect it and look after it and tune in. So
Mm.
tuning in, or awareness, or whatever we want to call that, as a fourth leg, for me, is an important part of the table.
Mm.
I love these metaphors that you're bringing in. It makes it so unbelievably relatable and just, it takes it out of this sort of psychopathologizing and all of that. And yeah, this is real. These are the humans behind these struggles. And that kind of makes me the four legs of the table. Let's move the conversation towards the support. And I'll
Mm.
start with you, Dr. Cornelia, and then also Heidi, if you can come in and tell us more about the support group that you have. But if a healthcare worker recognizes that they are struggling, what
Mm.
practical first steps can they take to access support and look after
Mm.
themselves?
So, in medicine, we speak about help and health-seeking behavior, which is your ability or your awareness that you need to get help, right? And I think we as healthcare professionals are very bad at this because we think we'll be fine. I just need to sleep. I just need to eat something. I'll be better. And over time, it gets to a point where we really do need help. So the first thing is, I think, be gracious with yourself. You
I
having
love
a
that.
struggle is is
Mm.
is normal. If you've gone through, and this used to happen to me on calls all the time. Before I used to go to a call, I would get so anxious. I would have to cry before I even leave the house because I was worried about what was coming and all of that. And then my family said, okay, so what's going to happen is whenever you have a call, we're going to have a very chill day before. We're going to sit with you, talk to you about what you're expecting to happen, and kind of work through strategies where if this happens, what are you going to do? Right. So that
Mm.
would give me the
Mm.
ability to say, okay, I'm really worried about this. It may or may not happen. I'm, pathologizing this call and I'm
Mm.
making it big in my
Mm.
head.
Mm.
That's just a
Mm.
part of the anxiety that I feel with a call. It's not necessarily a disorder because I'm still functional, but it is a fear that I have. How can I practically manage this fear? Helping people get me into myself and calm myself down while it's happening. So the first thing is self-awareness, as you said, Heidi. And the second thing is just kind of being gracious and
I
gracious with
love
yourself.
that. Yeah, it's
The next thing
kindness as
is
well, generosity, and I love the word
absolutely.
gracious. It's such a lovely word. Don't
I
often
think the
hear it.
next
It's
thing,
lovely.
yeah, thank you so much, Heidi. The next thing is when you are at work and you feel that you are not fine, there are various people that you can reach out to. The first person would be whoever you're on call or whoever you're at work with that you trust. So you have a colleague or you have someone you can talk to, and if they're not available, there are seniors that are responsible for you. And again, like in an academic circuit like ours, we do have people that are responsible for well-being or mentors that are allocated to you. And I think the other thing is a lot of people have campus health or campus wellness, or if you're in an academic institution or in the hospital, they have a staff clinic. But I know that I'm very wary to have that kind of support that I reach out to. So thankfully, I have my husband. I call him and I'm like, I'm not fine. And he's able to kind of speak to me about that. But if you don't have that person, I do ask that you do seek out a professional who is available for you, during working hours. But if not, the South African Depression and Anxiety Group has a 24-hour hotline. And you know what I found about the hotline is sometimes it's not that you need to leave where you are now. It's just that you are having a situation that you are not able to figure out. Maybe there's a patient who's just died and you are struggling to move on from that. Maybe there's a call that you're worried about, or there's a situation happening at work or in the community that you're in that's scaring you, and you just need to get it off of your chest, because the longer you keep it in your head, the more you're going to think about it and worry about it. Use the hotline as a way to get that off of your chest until you're able to find a more stable, lifelong support. And even as maybe Heidi will have some advice about ways to access support groups. So, one, self-awareness; two, have grace for yourself; three, use the resources at work either as a friend or as a formal structure in the form of mentorship or campus health or staff clinic. And then lastly, use external resources such as the South African Depression and Anxiety Group, and if you need to, obtain therapy or psychology services.
And number 5, all of the above.
Yes.
Just an additional perspective. Not everyone is in the public health sector. We often get calls from people in private practice, and sometimes not even in the directly medical healthcare world. Sometimes they're in the world of coaching or of organizational development. They're coming in. It's interesting. The spread is wider lately, I've noticed. And what that seems to allow for, again, is a sort of normalizing, is to realize that it's not only healthcare workers that are under such stress. It's probably all of us, and all of us can contribute ways in which we share ideas of what helps. And I take a very strong, I can be a bit authoritarian when it comes to the importance of supervision. I mean, I think what medical people don't use that word. People associate that word with being watched or monitored or disciplined. But in social work, we use supervision as a supportive, mentoring, early catch option for catching problems early or thinking together. And I believe very strongly that actually we can't do this work without the support of colleagues, of mentors, of experienced people, just of other people, especially those thinking of going into private practice. It's a very lonely space. And I think it literally, if I could, I would make it legally binding. You have to have supervision. You factor in a computer into your work when you budget. You've got to factor in supervision. Sometimes you have to pay for it. If you're clever enough, you can find some ways of not having to pay for it. For example, group supervision amongst colleagues can be a much more affordable option. A lot of companies, and I imagine that the healthcare institutions as well, have EAPs, have employee assistance programs, which are a very useful way to introduce you to affordable, no charge. In fact, it's not therapy. I object when people call it therapy, because I think that's a different. I'm fussy about words. But it's there for most people to be able to access. Is it a nervous thing to do? Is it hard to? We've already said it's hard for those of us in the so-called helping professions. By definition, we gear ourselves to helping others. So by definition, we don't so easily acknowledge that we need our own help. But if
And I think sometimes, Heidi, if I can jump in, we almost sometimes feel guilty for asking for help for ourselves, because I'm like, I deal with these people who are going through life-threatening illnesses. I mean, they're almost about to die. I'm counseling their families. Their whole lives are changing, and I'm just worried about my anxiety. That doesn't seem like a big enough problem for me to ask for help about. And that's really important, to not compare our lives with someone else's lives, and also not to our interventions and the things we need with someone else, because you and another person could experience the same trauma from a call or from a resus that has failed.
Absolutely.
You could go through exactly the same trauma debriefing. You could be in the same supportive work environment, but you could still feel a lot of guilt. And that's okay. That's why just because someone else has had the system work for them a particular way and it hasn't worked for you, it's not bad. It just means you need a little bit more
Absolutely.
support. And that's where grace comes in.
Absolutely. And if I remember before I became a social worker, when I was doing voluntary work for Power with abused women, I remember coming out of a meeting with someone who'd been so badly beaten up. I won't go into details. It was horrendous. And I said to my colleague as we left, we visited her in hospital, everything broken and bruised and horrendous. And I just said to my colleague, oh, she's going to go back into that relationship. I'm pretty sure of it. I'm sure that I felt so helpless. I'm sure what could we offer her? And my colleague, who had some years more experience than I did, said to me, I've never forgotten, Heidi, we just spent 1 hour with that woman, listening to her, devoted entirely to her, without criticizing her, without judging, without telling her what to do. That might be the first time she's ever had that. Don't ever underestimate, however big her problems are. Don't ever underestimate the value of your being there, having visited, having listened, having tolerated what she's told you, because that is more beneficial than any advice you could ever give her.
Wow.
That stays with me. I've often referred back to that conversation.
What
Beautiful.
a goosebump moment to kind of, I cannot believe that 30 minutes have already passed. I can honestly sit here and listen to each of you share your minds for so much longer. What an incredible
We could have a whole
way,
workshop
right?
just on the difference between selfish and self-care,
So,
selfish
Yes.
and self-responsibility, selfish
Yes.
or
no,
etc., etc.,
no, you've
etc.,
really brought your minds to
intelligent
this.
stress management.
And I think, yeah, you've like lifted that help being sort of I'm owning up to a weakness or something, and rather look at this wisdom, look at this, the sharing of minds, and just that being there to listen, and the power of that. So yeah, I'm sorry that we have to wrap it up. I don't even want to, but today we mark Socks for Docs. Everyone's wearing like
Oh,
crazy,
I love
funky,
that idea. I
mismatched
forgot
socks.
Wait, I have to show you my socks. I have to show
I think
Oh wow.
brilliant. I
Apologies
just
for my
think it's
feet in
such
the
a
frame.
lovely signal. It's a
I've got
signal to the world. I love it.
Yeah, I've got mushrooms on mine. So
Ooh.
with that, with just sort of on that light-hearted note, what message do each of you wish to, just want every healthcare worker to hear, final thought to leave them with, just, 30 seconds just to wrap up this incredible session with.
Can I grab it? You
Yes.
matter.
You matter.
You matter. Doesn't mean everyone else doesn't matter too, but you matter.
I think for me, it's to say, if someone was going and hearing the things that you are going through, and they were telling you all the things that you're going through, what advice would you give to them? You wouldn't shun them. You wouldn't tell them that they're being ridiculous. You wouldn't tell them that what they're going through is not significant, and you wouldn't advise them to not get help. So talk to yourself as if you are your own patient. Put
Oh,
as much
yeah,
effort
I
into
agree.
yourself as you put into your patients,
I
and
love
put as
that.
much empathy into yourself as you put into your patients, because you are your first patient, you are your first responsibility, and no one can get any help if you are not okay. The system will change, the system will move on, but we cannot replace you, to your family, to your friends, and to yourself. So take care of yourself. Mental, physical, and holistic health is very important. It can be daunting, but as Heidi had said, there's a network of people that you can reach out to, whether in your institution or in your family. And don't discount the advice of non-medical people in your life. They have experience.
Thank you so much.
Wow.
Thank
Honestly,
you, everyone.
both of you with your incredibly kind words, your relatable metaphors, but also just the kind of the deep reverence you have for healthcare workers, for the industry, for these people. I mean, I think it's done so much in 40 minutes to take away that stigma, that fear, those sort of barriers to accessing health. And thank you so much for your time. It really has been a sharing your expertise. It's been an honor listening to both of you, your insights and your experiences. Thank you so much. And
Thank you so
to
much
all
for the opportunity. Thank you, Daryl. Thank you, Ompile. Thank you, SADAG, for the wonderful work you do.
Awesome. And to all the healthcare workers who may be watching or listening, it is recorded, so it might go out there for a while where you can access it. We want to acknowledge the incredible work that you do every day. You spend so much of your time caring for others, often in challenging circumstances, and it is important to remember that you matter, as Heidi so beautifully said. Seeking support is not a sign of weakness. It is an act of self-awareness, courage, and self-care. Just
Oh,
as
yeah,
patients
courage. We didn't mention courage. Yes,
courage.
courage.
And just as patients deserve compassion and care, so do the people who care for them. So if today's conversation has resonated with you, or if you would like additional support, information, or resources, please visit SADAG's website at www.sadag.org, or contact the Health Workers Care Network helpline on 0800 21 21 21.
Oh,
Thank
and
you
can I
so
put in a
much for...
plug? Can I put in a plug
Yes,
for our
please,
end of
please,
the
please.
month? End of the month, last Thursday of every month, the Healthcare Workers Support Network group meeting. Everyone's welcome from 6 to 7. And it's an open group, so anyone can join in any way connected to the healthcare world. It's there every last Thursday of the month. I hope to see you there.
Wonderful. Thank you, thank you, thank you. So thank you for joining us for today's Sharing the Expertise. Please remember to like, follow, and share our social media platforms to see more about future events, resources, and mental health information. Take care of yourselves, and truly, thank you for all that you do for all of us. Until next time, goodbye from all of us at SADAG.
Thank you.
Thank you.
Thanks. Bye-bye.